This is a microdose episode on PSA testing, or prostate-specific antigen testing. This is an incredibly important topic, and we aim here to help men understand their risk and when to get tested for prostate cancer. To listen to the full episode and to hear Mike and I disagreeing agreeably on the merits of a rectal examination for prostate screening, please go back to episode number 2. We are Beyond the Limits, and this is PSA testing.
So prostate cancer is sometimes referred to as a disease of aging because many men with the condition essentially live symptom-free for years. In terms of its prevalence, so I think around 80% of men in their 80s are felt to have some cancerous cells in their prostate. The normal quoted stat generally is 1 in 8 men will get prostate cancer, but that actually is as small as 1 in 4 when it comes to black men. Family history is important to bear in mind. So 2.5 times more likely to get prostate cancer if your father or your brother has it. If they were young when that happened, so if either of them were under the age of 60, that increases your chances still further. The symptoms can be quite vague, quite non-specific. I think that can certainly play into delays in diagnosis. So, classically, we might say, well, issues with urination, you're struggling to urinate as you would expect, you're waking up more often in the night to pass urine, you're dribbling, that kind of thing. Potentially some erectile dysfunction. Equally, it's thought that hematospermia, so a bit of blood in the semen, can be suggestive. But in many cases, it's lethargy, it's fatigue, it's some non-specific back pain, and these are really common symptoms. They're very non-specific, as I say. So actually, the diagnosis can be quite challenging.
Yeah, and I'd go one step further and say prostate cancer can have no symptoms. It can be completely silent, which a lot of people think, well, if I don't have any symptoms, I'm fine. It's really worth mentioning that the second component there, so the blood test, we talk about this PSA or the prostate-specific antigen, the blood test that is then sent as part of the assessment can in some cases be normal. So that blood test can come back normal. However, the rectal examination can find a lump in the prostate. Despite the blood test being normal, you can have an abnormal feeling prostate. And I guess it's important to labour that point. And I often have patients saying, I'm here for the blood test. I don't want you going anywhere near me, kind of thing. I think it's important to be aware that the two are better than either in isolation, certainly.
PSA is really what this all boils down to ultimately, because this is the message that you hear quite commonly, particularly when someone who's well known is diagnosed with prostate cancer. They say, look, go and get your PSA done, go and get it checked. I was watching the cricket last summer, and they had the Bob Willis Day. He was another ex-England cricketer who died from prostate cancer, and the commentators, with all good intention, kept repeating, get your PSA checked, just go and get it done. It's a simple blood test. The plot thickens in terms of things a little bit more complicated, and that's what we're really kind of discussing today. Now, I think it's important just to clarify the limitations of what we're dealing with. So someone has their PSA done. If it is raised, it might be suggestive of prostate cancer. However, it can also be raised in a number of other situations. So we touched upon this already, but an infection of the prostate, so-called prostatitis, a urinary tract infection would also or could potentially cause a raise in PSA. Equally, vigorous exercise. So if you've been vigorously exercising in the hours or days leading up to having the test, that can potentially cause it to be artificially raised. And generally, the feeling is potentially ejaculating in the 48 hours prior to having the blood test can cause it to be artificially raised. So it's by no means a perfect test. Now, the generally understood stats on this is that if 7 people with no symptoms were to have a PSA test, 1 in 7 will have a raised PSA. So 85% of those will go on and have potentially a biopsy ultimately, and only 1 in 3 will have cancer. So by no means perfect test. Also worth bearing in mind that actually of those 6 remaining people out of the 7 who have a normal PSA, about 1 in 6 will have cancer. So it's also not necessarily good as a rule-out test. We might say well, I'll get my PSA done. It's likely to be negative, and if it is negative, I can reassure myself I don't have cancer. It may not be quite as simple as that.
It's important to mention that prostate cancer is very varied in terms of how aggressive it is, how symptomatic someone might be, and essentially what treatment would then be required. It differs massively depending on how how aggressive that cancer is, how far it's spread, where it's based, and also it has to consider the patient's age, their comorbidity. So that has to be considered in terms of, as part of the testing for the disease. You have to be, I guess we have to be mindful of, well, what is the expected outcome? To give you an example, an 80-year-old or a 90-year-old is very different from a 55-year-old, just given their life expectancy with a new diagnosis of prostate cancer. But of course, the difference in how aggressive a tumour can be as well.